Analyzing universal healthcare for Haiti. The access to affordable healthcare is something that many across the globe have trouble maintaining. But for those living in the developing world, the issue of access and affordability are far more dire. In this presentation, I will be discussing the problems that the country of Haiti faces regarding their healthcare system. Furthermore, we will look into the role that primary healthcare plays in advancing towards an ultimate goal of universal health coverage. When most of us think of Haiti, we picture images of desperate poverty, political unrest, and natural disaster. A 7.0 magnitude earthquake in 2010 and the damage of Hurricane Matthew in 2016 had placed Haiti back on the world stage and back on the timelines of our social media feeds. In the wake of these two catastrophic disasters, we saw an enormous response from the world community. It's been close to a decade since that 2010 earthquake and the initial relief effort began. This relief effort would claim to put Haiti back on the right track, but billions of dollars later, there's little evidence to support any such claim. The healthcare system of Haiti, much like every other system, is highly unstable. Poor planning and improper distribution of funds has yielded insufficient results. Haiti has many hospitals, but according to a World Bank study conducted in 2017, many of them are ineffective. The issue here is that many of Haiti's donor partners have invested millions of dollars into state-of-the-art medical facilities with no real plan to combat running costs. So today, Haiti has plenty of hospitals, and instead of dumping more money into curative care, they need to shift their focus to preventative care. Furthermore, if Haiti wants to meet a future healthcare policy goal of universal health coverage, they definitely need to shift their focus to primary care. So the three major issues here that is crippling Haiti's healthcare system is affordability, accessibility, and expenditure. Affordability is the major issue that is barring citizens from seeking healthcare of any kind. Most of Haiti's healthcare system operates on a payment at point of service method, which means that when you go to the doctor or the hospital, no matter what services you're getting, you have to pay for them right up front. And with the average Haitian living on less than $2 a day, you can see how this can become a major problem. The second issue here is accessibility. There's a high concentration of hospitals and medical facilities in and around Port-au-Prince, which is the nation's capital, as well as other urban cities. However, the native inhabitants of Haiti named the country Haiti, or Haiti, which means land of mountains. So a large percentage of of Haiti's population lives in mountainous or rural region. As you can see in this graph, a large percentage of the rural population doesn't have good access to quality primary care. And the third major issue is expenditures. In the past 10 years, due to acute emergency situations, a majority of Haiti's health financing has come from external sources. However, despite a large amount of external funding, Haiti spends less on health care than other Latin American countries and other countries with similar incomes. So as you can see in this graph, it shows that in the past 10 years, Haiti has spent less and less on health care, except for in a few spikes, but it has definitely gone down in the past 10 years compared to other Latin American countries. So some solutions that have been tried in the past have not worked for Haiti, and these solutions are based off of emergency situations. So in these emergency situations, they have placed a lot of money into building new hospitals. Instead of building these new hospitals, they really need to strengthen the system that is behind these hospitals, and they definitely need to focus on primary care. In 2008, the World Health Report declared that primary care was a global priority, now more than ever. Primary care forms the cornerstone of a functional health system. So if Haiti really wants to get closer to this goal of universal health coverage, they need to focus on that primary care. So some steps towards, obtaining universal health coverage would be to define what that is for Haiti, who is able to pay and who can't pay. This coverage needs to be based off of disease burden that's specific to Haiti, and they need to look at what can be covered right now and what will be implemented later. Second step is cost analytics. They need to team up with the scientific community to analyze, the feasibility of, a comprehensive universal healthcare package. The third step would be, again, the focus on primary care and increasing accessibility to facilities for the rural population, and to focus on populations that are most at risk, which is, women and small children. So fundraising is definitely a major issue here. Universal health coverage is a very ambitious goal, and it definitely won't happen overnight. In Ernest Attenier's 2018 book, A Call to Win the Third War of Independence for Haiti, Attenier highlights a couple strategies that can help Haiti become more financially independent. One strategy he proposes is a waste to energy program. Haiti doesn't really have a good sanitation department, so this would help clean that up and also harness, some energy to back some of these medical facilities. And again, over here, he also proposes solar power. Solar power would also help harness some energy and create, another great industry for Haiti. Another thing he proposes is tourism. Haiti has the perfect backdrop and climate for a thriving tourist industry. So trying to build a tourist industry would definitely help bring in a lot of money for Haiti. And lastly, the implementation of a tax on certain luxury goods such as cigarettes and liquor would greatly benefit Haiti and definitely build some more funds for them. So, a call to action. Haiti is the first free black republic in the world and has been an independent nation for over 200 years. Yet today, Haiti is the poorest country in the Western Hemisphere. Decades of corrupt leadership, disease burden, and natural disaster has left Haiti in the past. The implementation of universal health coverage would significantly improve the lives of Haitians, but the cause of Haiti's problems is also the solution. That is the people. The healthcare community of Haiti and the citizens need to advocate and push for universal health coverage and to push for building a better life and better care, not only for the current population, but for those who are to come in the future. So basically, the key to Haiti's destiny is in the hands of the citizens themselves.